So we're looking at another condition which could affect the amniotic fluid this morning. Now this is what is known as oligohydramnios. Oligohydramnios. Alright, so oligohydramnios just have to do with, that fluid that is around the baby. That's the amniotic fluid. So the fluid is getting small. That's what is known as oligohydramnios. Of course, that fluid is supposed to be sufficient because the baby swims in the fluid, has its freedom in the fluid. So if you have little fluid, that means what? You have little freedom for the baby. You understand? So it's a condition during pregnancy where there's too little amniotic fluid surrounding the baby. That's this blue stuff. It's small. Alright? So amniotic fluid is essential. It's very important for your baby to develop properly. It cushions the baby, help with lung development, help with digestive system development, and keeps the umbilical cord suspended so that it doesn't collapse. Now, from the definition, you can start thinking about all the complications that will come out if the amniotic fluid is small. So how is it diagnosed? It's usually diagnosed when the amniotic fluid index is less than 5 centimeters or the maximum vertical pocket is less than 2 centimeters. It affects about 4% of pregnancies, especially in the third trimester. Causes of oligohydramnios: it could be preterm premature rupture of membranes, it could be placental insufficiency, it could be fetal kidney issues, it could be post-term pregnancy. The pregnancy have gone past the normal time that we want babies to stay in the stomach. You understand? It could be maternal conditions, it could be certain infections that maybe the mom has. Risks and complication is the baby is restricted. So there's fetal growth restriction. It doesn't have their freedom, Limb contractions or deformities. Where's my cursor? Sorry. Oh, I think my this thing freeze for a while. Alright, limb contractions or deformities. This is all from restriction, Pulmonary hypoplasia, underdeveloped lungs, umbilical cord compressions. There's increased risk of cesarean delivery. The mother will have no option than to come and deliver through cesarean section. So diagnosis, how you can actually dictate this before, ultrasound, fundal height, speculum examination, fetal monitoring. Then treatments include hydration, so they can be, giving all those fluids just to increase the amniotic fluid again. Amnio infusion, this one, they will try to increase the amniotic fluid directly. Alright, they can put saline or lactate ringers, into the amniotic sac, and these ones are physiological solutions, so your body will still accept them. You understand? Maternal rest, early delivery, treat any underlying cause if she has hypertension or diabetes.